Mike. My name's Deanna. I'm a Youngstown State Nurse Practitioner student. How are you?
Good.
Good. So today we're going to be doing a head-to-toe assessment. Did you have any questions before we get started?
No.
All right. Well, everything is going to be 100% confidential, so if you have any questions while I'm doing the examination, please feel free to stop me.
Okay.
The first thing I'm going to do is just kind of inspect over your skin here. If you can just bring your arms to the side. Good. And your skin is appropriate color. I don't see any abrasions or any concerns with the skin. It looks nice and intact. I do notice you have some freckles here on both of your forearms, and they are round, small in shape, regular defined border, so nothing too concerning with those. Also, as I'm sitting here, you have good hygiene. I don't notice any odors. I'm going to go ahead now and just go ahead and palpate your skin. Okay. And your skin is nice, warm to touch. There is no perspiration noted. And then I am going to just kind of pinch over here in your clavicle area, and no tenting noted, so your turgor is intact as well. Okay, so I am going to do a test with your nails. So what I'm going to do is, if you can bring your nails out for me, your nail beds look nice and pink. I am just going to put this paper here, and I am checking for clubbing. And the angle is 160, so that's normal. Another test we can do to check for clubbing is if you kind of make your hands like a heart for me and bring them together. Okay, and no evidence of clubbing noted. Okay, now I'm just going to go ahead and look at your hair. So your hair is nice and dark brown. It has some areas of gray. It looks like it's even distribution, but there is some receding hair right here in the front. And then I'm just going to take a peek throughout your hair, and I don't see any lesions, any ticks, anything concerning, no dandruff noted. And then your head is nice and aligned with the rest of your body. Head's nice and midline. The trachea is nice and midline. I'm just going to kind of pull it here. No tugging, no protrusion, no masses. Go ahead and smile for me. Good. Your face is nice and symmetrical. And I'm going to go ahead and just palpate your frontal sinuses here. Just let me know if there's any pain or tenderness during this. Any pain while I was doing that?
No.
And then I'm going to go ahead and palpate your maxillary sinuses. Any pain?
No.
Okay. And I'm just going to palpate like your mastoid process. Any pain there?
No.
Good. All right. And then I'm going to go on to your neck here. And with your neck is nice and symmetrical. I don't notice any like webbing, masses. Can you go ahead and just turn your head to the right and to the left? Good. Nice range of motion. I am going to check your thyroid too. So what I'm going to do is I'm going to have you take a drink of this when I tell you, but I just have to have you kind of step that way a little bit here. I'm just going to go behind you. All right, and then why don't you go ahead and take a drink of that water for me, Mike. Okay, and as you were taking a drink of water, the hyoid bone was moving up, which is a normal finding. I couldn't palpate your thyroid, so it's definitely not enlarged. Did you have any pain with that?
No.
Okay, and I didn't see any nodules either. Okay. Next thing I'm going to do is just check over the lymph nodes. So I'm just going to be, taking my fingers around them. If you feel any tenderness at any point, please stop me, okay? So I'm just going to do the preauricular, the postauricular, the submandibular, submental, and then this is the anterior cervical, posterior cervical. Go ahead and turn your head to the side for me. This is the sternocleidomastoid, and then the next one, the sternocleidal, and then I'm going to do the supraclavicular, postclavicular, and I'm going to do the occiput. Okay, and I didn't palpate any of the lymph nodes. Did you have any tenderness with any of those spots? Okay, good. All right. So next I'm going to go ahead and just listen for some what's called bruits. So I'm just going to put my stethoscope on a couple of different locations on your face here. So I'm going to go ahead and just do the temporal area. Okay. Good. And then the eyes. And the thyroid. Okay, and no bruise noted. Next, I'm going to go ahead and assess for some TMJ. So what I'm going to have you do is just open and close your mouth. Okay, any pain with that motion? No. All right, and I did not feel any crepitus, any popping or clicking, and there was no pain, so no TMJ noted. Next, we're going to go ahead and do a vision test. So, Mike, if you can just tell me, do you wear any glasses or contacts?
No.
Okay, so what I'm going to do here is I'm going to hold this chart. I'm going to step back some feet. And I want you to just try to read down to line 8 here. First, I'm going to have you close one eye at a time.
D-E-F-P-O-T-E-C.
Okay, and then go ahead and close your other eye.
D-E-F-P-O-T-E-C.
Good. And go ahead and do it with both eyes.
D-E-F-P-O-T-E-C.
Perfect. So vision is 20/20 in both eyes. Next, we're going to do what's called a confrontation test. So I'm going to have you go ahead and close an eye for me with cover your eye. I'm going to cover my eye too, and I want you to tell me how many fingers I'm holding up and when you see them, okay?
3.
Okay, and
2.
Okay, and then cover your other eye.
2.
Okay.
1.
Good. Okay. All right, so next I'm just going to look over some of the features on your face. So your eyebrows look nice and even, symmetrical. I'm going to go ahead and just palpate over like your eyes here in the orbital area. Any tenderness here?
No.
Okay, good. All right, and then your eyelids, if you could just close your eyes, I'm just going to take a peek at your eyelids here. And I don't notice any drooping, no swelling, redness, flakiness. They look symmetrical. All right, and then I'm going to have you go ahead and open your eyes back up. And I'm just going to like bring down your eyelids here. And the conjunctiva is nice and pink. There's no discharge. I don't see any foreign bodies. The lacrimal glands are not enlarged. And then I'm going to go ahead and just kind of look at your eye here. So I'm going to have you just kind of look straight ahead for me, and I'm just going to shine my light into your eye just to see how reactive it is, okay? So just kind of keep looking straight ahead. Good. And then I'm going to do the same thing with this eye. Good. So your pupils are nice, round, reactive to light. They are a 7, and then whenever I shine the light in, they constrict down to about a 3. And then your irids are nice and green. The sclera is nice and transparent. There's no discharge from any of the eyes. And then also, whenever I was doing that, I was checking for any pupillary defect, which I did not see. So then we're going to check for accommodation. So I'm going to have you look behind me, and then I'm going to bring this here, and then go ahead and follow this in. Good, and no nystagmus noted there. And then we're going to just check here. I'm going to stand back, and I'm going to shine this light in both of your eyes here. I might have to turn this light off for just a second. Okay, and I could see a corneal light symmetrically in both eyes. So next we're going to do the cover-uncover test. So go ahead and cover up one eye, and then uncover. Good. And then uncover. Okay. And that was an appropriate finding. The uncovered eye was reactive as you uncovered it and constricted. Next we'll do the cardinal field of gaze. So I'm going to have you go ahead and just follow my finger for me. Good. And then no nystagmus noted as you were doing that. The ocular motor nerve is correctly working with that test. All right, so next I'm going to go ahead and just get out my otoscope here. And I just want you to tell me if at any point this light's bothering you, we could take a little break, okay? So the first thing I'm going to do is I am going to go ahead and start with your right eye first. So I'm just going to look for the red reflex, and I'm going to follow it in. And I'm just going to kind of come over in an angle. Are you okay, Mike?
Mm-hmm.
Okay, so just bear with me. And I'm just just gonna rest my thumb up here on your eyelid. Okay, and the retina is nice and yellow. I could visualize some of the blood vessels, and they are, the vein is greater than the artery. There's no evidence of any cotton wool spots, no AV nicking. I'm just gonna come around more central here. And as I'm looking into your eye here, it looks like the optic disc is also yellow in color. The macula looks like a little light dot, and the anterior chamber of depth is appropriate. Okay, so now let me go ahead and do the other eye here. Are you okay?
Mhm.
You need to close your eyes for a second? Okay. Go ahead and just look straight ahead, and I'm going to do the same thing here, and I'm just going to bring this close and look for the red reflex, which is present, and I'm just going to go ahead and I'm following it in. Okay, and I can go ahead and I can visualize the macula, or I can visualize the retina. It's yellow in color. The artery, the blood vessels are visualized. The vein is greater than the artery, and there is no evidence of AV nicking or cotton wool spots. I'm going to just go ahead and come back to the front here, and as I'm coming to the front, I'm just visualizing your optic disc, and the optic disc is also yellow in color, and the macula is like a light dot, and no evidence of any abnormalities. The anterior chamber of depth is appropriate as well. Okay, so next let me just go ahead and look at your ears here. So your ears look nice, they're symmetrical. I'm just going to kind of tug. Any pain or tenderness?
No.
Okay, good. And it looks like the auricle is vertical with the inner canthus of your eye. Okay, so next let me go ahead and just change to the to check your ear here. Okay, so I'm just going to look into the auditory canal and just visualize your ear and make sure everything looks normal. So I'm just going to go ahead and pull your painter back here and bring this in. And as I'm in here visualizing the ear canal, there is some hair, a little bit of hair. I don't see any cerumen. I don't see any foreign bodies. I can visualize the bony prominence. The tympanic membrane is a nice pearly white. No signs of any redness, swelling, or bulging. Okay, so let me go ahead over to your other ear here. And I'm just going to go ahead and pull your ear back. You okay?
Mm-hmm.
All right, good. So no cerumen in this ear. There is a little bit of hair noted in the auditory canal. The tympanic membrane is visualized. It is a pearly white in color, no redness, no swelling, no foreign bodies, and I can see the pony prominence visualized as well. So both normal findings for that. Okay, so now we're going to do a couple different hearing tests, Mike. The first one's called the Weber test. So what I'm going to do is I'm just going to go ahead and activate the tuning fork, and I'm going to place it on your head. And I just want you to tell me if you hear the sound right, left, or same on both sides, okay?
Same.
Okay, good. All right, this next one is called the Renee test. So with the Renee test, I am just going to have you tell me when you stop hearing the sound, okay? Can you hear it?
Mm-hmm.
Okay, tell me when it stops.
Okay.
Okay, and can you hear it here?
Yeah.
Okay, tell me when that stops.
Okay.
Good. All right, we're going to do the same thing on the other side here. You hear it?
Mm-hmm.
Okay, tell me when it stops.
Okay.
Okay, and tell me when it stops here.
Okay.
Okay, so that just confirms that air conduction is greater than bone conduction, which is a normal finding. Last part of the hearing test is called the whisper test. So I'm just gonna have you occlude one of your ears for me, and I am just going to come back and say a word. I want you to tell me what I'm saying. Football.
Football.
Good. And then I want you to do the same with that.
Baseball.
Good. All right. So hearing is intact bilaterally. The next thing we're going to do is I'm just going to take a look at your nose here. And I just am looking at the size and the shape. Everything looks symmetrical. I don't see any masses or any concerns. I don't see any discharge coming out of your nose right now. I'm going to just palpate this area. Any pain with
No.
palpation? Okay, good. So I am going to go ahead and just turn my light on, and I am going to look inside your nostril. So just tilt your head back a little bit. Okay, so your nostril looks nice, pink, moist. I don't see any foreign bodies, no discharge. The turbinates are not swollen. And then I'm going to go to your right nostril, and it looks intact, no foreign bodies. The turbinates are not swollen. This area is nice, pink, and intact as well. And then I already assessed your frontal and your maxillary sinuses. So next thing I'm going to do is just go ahead and look at your lips. So your lips look nice, soft, smooth. I don't see any chapping on them. Can you go ahead and just smile? Good. So your smile's good. Go ahead and just smile real big. Good. And it looks like you have proper occlusion. The upper molars fit well into the lower molars. I'm just going to have you go ahead and open up your mouth for me so I can visualize inside. I don't see any missing teeth, no dental caries. And then can you open up real wide for me? Good. The posterior pharynx is nice and pink. Can you say ah? Good. And then do you happen to have your tonsils?
No.
Okay. All right. And then go ahead and open one more time. Okay. The buccal mucosa is nice and pink. Just gonna look up a little bit here. The gingiva is nice and like a coral pink color, moist, no bleeding or redness. Okay, and go ahead, stick out your tongue for me. All right, good. Your tongue's nice, pink, symmetrical. Go side to side with your tongue. Good. So your tongue seems to be symmetrical, moving well. No swelling or ulcerations. Whenever you said your uvula did raise up, and the posterior pharynx was nice pink when I was assessing. One thing I would do at this point would be I would elicit a gag reflex, which I would do by taking a tongue blade and just poking at the back of the posterior pharynx, which a gag reflex is present. And then we're deferring the tonsil since he had his removed. Okay. So the next part is going to be the assessment of the chest and the lungs, Mike. So what I'm going to do is I'm just going to start out by going ahead and taking your pulse. So I'm just going to go ahead and listen here and watch. Okay. So your pulse is 80. As I was checking your pulse, I was also checking your respiratory rate, which is 16. And you have symmetrical chest movement, no use of any accessory muscles, no evidence of any dyspnea on assessment. Okay, and then your anterior to posterior lateral is 2-to-1, which is a normal finding. And I don't hear any audible adventitious lung sounds as you're sitting next to me. I don't hear any wheezing. I don't hear any crackles. I don't hear like any friction rub, and no stridor. So that's a good thing. Okay, so now I'm going to have you just kind of turn to the side here so I can check your thoracic expansion. Keep coming just a little bit more if you can. And I'm just going to come down to like here. Go ahead and take a breath in. Good. And nice, even, symmetrical expansion with breathing bilaterally. And then I'm going to go ahead and just check. You can go ahead and turn straight again. I'm going to have you just sit there while I press down. I'm feeling for what's called any crepitus. Go ahead and lift up your arms for me. Okay, and turn a little bit to that side again. Okay, so no evidence of crepitus with that. Okay, Next I'm gonna just do what's called check for tactile firmness. So if you can turn this way for me, I just want you to say 99.
99, 99, 99, 99, 99.
Okay, and lift up your shirt or your hands there.
99, 99, 99.
Okay.
99, 99, 99.
Good. So symmetrical, unaccentuated tactile firmness is noted. And then I'm going to go ahead and do what's called a measurement of the diaphragmatic excursion. So if you could just turn like with your back facing the camera, I am going to have you take a deep breath in and hold it. And I'm going to, yeah, that's perfect. And then I'm going to actually percuss down until I go from resonance until I get to some dullness. So just bear with me here, okay? Take a deep breath in, hold it. Okay, and then go ahead and breathe normal. And then I want you to exhale for me. And then I'm going to have you hold that exhale. Okay, and then I'm going to do the same. Go ahead and breathe normal again. And then take a nice deep breath, and I'm going to have you hold it for me. Okay, and take a breath in and out, and exhale for me real deep, and hold that. Okay, and now I'm just gonna go ahead and measure this area, and a normal measurement would be 3 to 4, 3 to 5, and we are at, sorry, this forward. We are at 3 on both sides. So that's a normal finding. You can go ahead and have a seat now, Mike. Okay, now I'm just gonna go ahead and listen to all of your lung fields here. Okay, go ahead and take a deep breath in and out. Deep breath in and out. Good. And every time I put the stethoscope on, just a breath in and out. Okay, and then go ahead and lift up this arm over here. Take a nice breath in and out. In and out. Go ahead and lift up your other arm. Big breath in and out. Okay, and then go ahead and just turn if you want to stand up or if you want to just, yeah. Okay, all right, deep breath in. Breath in and out. Breath in and out. Okay, go ahead, have a seat, Mike. All right, good. So lung sounds are clear bilaterally and all of the lobes. Next, we're going to do something called vocal resonance. So what I'm going to do is I'm going to listen, but this time when I put my stethoscope down, I want you just to say the word 99 for me, okay?
99, 99, 99, 99, 99, 99.
Okay, and lift up your arms here.
99, 99, 99, 99.
Okay, and go ahead and stand up for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. All right, so as I was listening, everything sounded muffled, which is a normal finding. You can go ahead and have a seat for me. So that means there's no evidence of any consolidations present. Next, I am gonna have you just go ahead and lie down, and we'll go ahead and check the anatomical landmarks here. So if you can go ahead and just lift up your shirt for me. And I am just gonna kind of like bring my hand here and I'm just palpating the apex of the heart and the sternum and sternal borders here. And it looks like you have symmetrical chest wall. The sternum's nice and flat. And then I am just going to check for an apical impulse. And I don't visualize one, but and I'm able to feel a very gentle apical impulse in this position. And then if you could just go ahead and sit back up, I just want to see if I could check that in another position. Okay, so a gentle impulse, I'm just going to visualize here. Okay, and I'm not able to visualize it, but that's okay. Go ahead and sit down for me. All right, so now I'm just gonna go ahead and palpate here for any thrills or heaves or lifts. Okay, and no, I can't palpate any thrills, heaves, or lifts. Now I'm just gonna inspect for any heaves. And no heaves present either. All right, so I'm gonna go ahead and I am going to listen for any heart murmurs. So what I'm gonna have you do is just the first time I do it, every time I put the stethoscope down, I am going to have you just hold your breath for me, okay? Go ahead and hold your breath. This is the aortic. Okay, go ahead and breathe. The pulmonic, go ahead and hold your breath. And this is Erb's point, go ahead and hold your breath. And breathe. This is the tricuspid, go ahead and hold your breath. Good. And breathe. And this is the mitral, go ahead and hold your breath. Good. So no murmurs noted when I was listening to while you were holding your breath. Now I am just going to listen without you holding your breath. So this is the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I could hear S1, S2, no splitting sounds as I was listening, and no heart murmurs in that position. So next I do have to have you turn to the left side for me. If you could just kind of bring your body this way so I can, yeah, perfect. All right, so go ahead, and this is the aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. So no murmurs present in that position. Next, I'm going to have you go ahead up to a sitting position so I could also listen to you in that position. Some heart murmurs are only present in different positions, so that's why we're doing all the various. Okay, so go ahead and just breathe normal. This is the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and no murmurs present on auscultation. The next thing I am going to do is if I did hear a murmur, there is some different things I would look for, and that would be the site of the murmur, the characteristics of the murmur, the intensity of the murmur, if there's any radiation variation of murmur, the pitch, timing, and if it varies with like rhythmic breathing. But we didn't have any murmurs present, so that is a good thing. Okay, next we're moving on to the abdominal and blood vessels. So for this, I can have you go ahead and just lay down for me, Mike. I'm gonna go ahead and lift up your shirt here so I can just visualize your stomach. And I'm just looking for, you know, everything looks appropriate, skin color is appropriate on your stomach. It's symmetrical with breathing, your belly is rounded, not distended though. And you also have good venous return above the umbilicus and below the umbilicus. Okay, so now what I'm gonna do is just have you raise your head for me. Okay, and I don't see any masses, bulges, or distus rectus as you are doing that. So that is normal finding. I'm gonna go ahead and I am just gonna listen to all of your vowel sounds now. So I'm gonna just start right down here in the right inguinal, right lumbar, right hypochondriac, left hypochondriac, left lumbar, left inguinal, hypogastric, umbilical, epigastric. Okay, good. So you have active vowel sounds in all 9 quadrants. The next thing I am going to do is I am just going to check for any bruits. So I'm going to just take another listen here. So I'm just going to listen to the aortic here. And I'm going to listen over here to the renal. Renal. Okay, left iliac. Right iliac. Okay, and I'm going to listen here to the femoral. Okay, and no bruits noted. Do you need to take a break, Mike?
No, I'm good.
Okay. All right. So next, I am going to have you, I'm just going to percuss your quadrants. Do you have any pain before I start percussing?
No.
Okay. So I am just going to go around all 9 quadrants. Okay, and tympani noted throughout all 9 quadrants. Sometimes it will be dull if you're over like the spleen or a specific organ. Okay, and next I am just going to do the liver border. So I'm going to bring this up here and I will need a piece of tape here to measure the liver span. So I'm just going to percuss to see what your liver span is. Okay. I'm just going to move that a little bit more if you can. Thank you. Okay, and then I'm going to come up this way. And I'm going to go ahead and just measure this. And 6 to 10 is a normal measurement, and we are at like a 6 there. Okay. Next, I'm going to go ahead and just percuss your spleen. So I'm going to bring this over here. I want you to take some nice breaths in and out for me. Nice breaths in and out. Okay, and there was no dullness, so I could just feel hear tympani throughout, so no spleen enlargement noted. The next thing I'm going to do is just check for your gastric air bubbles. So I'm just going to percuss down here. Okay, and gastric air bubble is right here. Okay. All right, so I'm gonna go ahead and do some light palpation. Any pain or tenderness anywhere?
No.
Okay, whenever I'm doing this, just let me know if you feel any pain or tenderness, okay? So, this is the right inguinal area. This is the, right lumbar, right hypochondriac, left hypochondriac, left lumbar, left inguinal, hypogastric, umbilical, and epigastric. And I'm gonna go ahead, any pain or tenderness with any of those spots?
No.
Okay, and I didn't feel any masses, bulges, anything concerning. You had no tenderness. And then I'm gonna do some deep palpation. So we already established there's no pain or tenderness. So I'm gonna go ahead and just press a little bit harder this time. So this is the right inguinal, this is the right lumbar, right hypochondriac, left hypochondriac, left lumbar, left inguinal. This is the hypogastric, umbilical, and epigastric. And then I am gonna go around the umbilical ring here and the umbilicus. Okay, any pain or tenderness with any of those spots?
No.
Okay, good. All right, so no tenderness, no masses noted. Next I'm gonna go ahead and I am just gonna check for the liver border. So I'm gonna put my hand underneath here and I'm just gonna kind of palpate here, and I don't feel your liver palpable. And then another method is called the hook method, where you kind of come up behind and just dig in right here to like the ribs to see if you palpate any like any firm ridge, which I do not. So I cannot feel the liver. Was there any pain or tenderness with that?
No.
Okay. So next I'm gonna go ahead and I'm just gonna push down a little bit right here. And any pain while I'm pushing down?
No.
Okay, what about when I release?
No.
Okay, so that's a negative Murphy sign. All right, and then we're gonna go ahead and do your spleen now. So I'm just gonna put my one arm here and I'm gonna palpate up any pain or tenderness.
No.
Okay, and I do not palpate the spleen. Okay, I'm gonna do each side of your kidneys now, so I'm just gonna bring an arm up and kind of squeeze a little bit. Okay, and then we'll do the other side. All right, and then I was unable to palpate any of the kidneys, any pain while I was doing that.
No.
Good. All right, so I'm just looking to look for the aortic pulsation. Okay, and yours is like a 3 in width, very gentle. Okay. All right, next I'm gonna go ahead and press down right here in this area. Any pain or tenderness here?
No.
Okay, so that is a negative, McBurney sign. That means like you don't have any evidence of appendicitis. Another method would be if you wanted to lift up your right leg for me and let me know if you have any pain in this area. Go ahead. Any pain right here?
No.
Okay. All right, so that's another way to test to see if they have appendicitis. Okay. Next, I am going to have you just go ahead and sit up, Mike, for me. And I am going to check the costa vertebral angle, so if you could face that way. I am just going to percuss. Let me know if you have any pain or tenderness. Any pain there?
No.
Okay. Pain or tenderness?
No.
Good. All right. So the next part of the assessment is I'm going to go ahead and I am just going to check all of your different brachial, radial, all your different pulses. I'm just going to assess here. It looks like there is like even distribution of like hair. Okay, so I'm going to start with the carotid first, and I'm going to do one carotid at a time. Okay. Okay, and a +2 amplitude, regular rate, rhythm noted. Next, I'm going to go ahead and just do your radials. And bilaterally, they are a +2. And smooth contour, regular rate, rhythm. And then I'm going to go ahead and just do your brachial radialis. So the brachial ones here. Good. 2 plus smooth contour, regular rate rhythm. If you want to go ahead and lay down for me, it'll be easier to check your lower extremities. All right, so I'm going to go ahead and check your femoral, and they are a +2, smooth, regular contour, +2. Go ahead and bring your knee up for me so I can check the popliteal. Good. And then bring the other one so I can check the popliteal. Okay, 2 plus, smooth, regular contour. I'm going to check the dorsalis pedis here. Okay, and bilaterally 2 plus, smooth, round, regular contour. And I'm going to go ahead and just check the posterior tibial. And the posterior tibials are also +2, smooth contour, regular rate rhythm. Okay, good. And then I am going to just check too for some jugular vein distension. So if you could turn your head to the side, I'm just going to shine a little light here. And I do not see any distension noted. I am able to see your the pulsation, but I can differentiate it from the carotid. I'm going to go ahead and just do a measurement to see what the pressure is. So if you could just bring this arm to your side for a second, and I am going to use this. Okay, check here. Just bring your head to the side again for me. Go look that way. Perfect. Okay, and we're at a 6. Normal is anything below 9 centimeters of water. Okay, and then I'm just looking at the color of your skin to check like your peripheral arteries. Your skin's nice and warm. It's pink. I don't see any evidence of any varicosities, even hair distribution throughout. No redness, ulcerations. No swelling. Let me just check for any pitting edema. And no pitting edema noted either. Okay, and then Mike, if you want to go ahead and sit up for me, I'm going to check your carotids for any signs of any bruise. Okay, and I'm going to have you hold your breath for this. Okay, breathe. And hold your breath again. And no evidence of any bruise upon auscultation. And then I'm also just going to evaluate you for jugular vein distension in another position. So I'll just do it right here. Let me just get my light to really visualize over here, and turn your head to the side for me. Good, and I don't see any evidence of any jugular vein distension. All right, now moving on, we're going to start doing testing out the cranial nerves. Okay, Mike, so what I'm going to have you do is just close your eyes. We're actually going to check for smells. So if you could occlude one nostril at a time. Okay, go ahead and tell me what you smell. Oh, sorry.
Vanilla.
No, wipe it off your face. Okay, thanks, sorry. The next one, I'm gonna have you close your eyes again and tell me what you smell.
Cucumber.
Good. All right. So cranial nerve number 1, olfactory nerve, is intact. The next one is the optic nerve, cranial nerve number 2. However, we already evaluated that with the Snellen chart and the confrontation test, which was good. So we already know that is intact. Cranial nerve number 3 is the ocular motor. Cranial number 4 is the trochlear, and the cranial nerve number 6 is the abducens. And we also tested that whenever we were doing the different visual fields, the accommodation, the perla, when I checked the light shining to make sure your eyes were reactive. So we know all of those are also intact. Next, I'm going to go ahead and do the trigeminal. So I'm just going to put my hand on your face here, and I'm going to have you like bite down and clench your teeth. Good. And then I want you to go ahead and, oh, never mind. I'm sorry. I'm going to just test for if you're able to discern between dullness or sharpness. So I'm going to have you close your eyes for me. Okay, and there was good tone whenever you were clenching down with the facial muscle. So just tell me if you feel something sharp or dull.
Sharp.
Okay.
Dull. Dull. Dull.
So cranial nerve number 5 is intact. Now we're going to go ahead on to cranial nerve number 7, which is the facial nerve. And I just want you to go ahead and open your eyes really wide, close your eyes, go ahead and smile, go ahead and frown, okay, and then puff out your cheeks. Okay, good. So your cranial nerve number 7 is nice and intact. We already tested cranial nerve number 8 when we did the Weber, the Renee, and the Whisper test, so we know those are intact as well. Cranial nerve number 9 is a glossopharyngeal, which we know is intact, as I was able to elicit a gag reflex, and when I had you say the uvula did rise up. The next one is cranial nerve number 10, which is the vagus nerve. So what I'm going to have you do for that is I'm just going to have you swallow. Good. And you were able to appropriately swallow. And as you've been talking throughout this whole assessment, I have not noticed any hoarseness. So cranial nerve number 10 is also intact. Cranial nerve number 11 is next, which is the spinal accessory nerve. So what I'm going to do is just put my shoulders here, and I'm going to have you shrug your shoulders for me. Good. And do it again. Good. And then I'm going to have you turn your head and just put some resistance and turn your head to that side. Good. So cranial nerve number 11 is intact. Hypoglossal is the next cranial nerve number 12. So go ahead and just stick out your tongue. Good. Side to side. Good. All right, so next we're going to check for cerebral function and proprioception. And what I'm going to start with is checking your rapid rhythmic motions movement. So I'm going to have you go like this, and I'm going to have you try to go faster. Great, great. Okay, next we're going to do the finger to nose test. So what I'm going to do is have you touch your finger, and then you're going to touch my finger with your finger. Yep, good. All right, next I'm going to have you take your heel to your shin and just bring it up your leg. Good, and then the other one. Good, and you were able to appropriately do that. Next I'm going to have you stand up for me, and you're going to walk normal that way. Good, and walk back towards me. All right, and then this time we're going to do heel to toe, and I'm going to have you step heel to toe walking forward. Good, and then I want you to go ahead and do that backwards. So turn, yeah, backwards, yeah. Okay, and you had good balance. Great, go ahead and have a seat. Good balance, posture was erect, symmetrical movements as you were walking, arms swayed appropriately with the rest of the body, and you exhibited good balance. Next, we're gonna do what's called the Romberg test. So what you're going to do is just stand up, and you're going to be, your feet will be shoulder width apart. You're going to cross your arms across you like that. And then what I'm going to have you do is just go ahead and close your eyes. And we'll just see how you do. A little bit of a sway is okay, but if you lose your balance, that would be a positive test. So just keep like that. Okay, good. So negative Romberg test. Next, we are going to just test some of the, you can have a seat, Mike. I'm going to have you close your eyes again. I'm going to test to see how you are able to respond to touch, if you're able to decipher between dull and sharp, okay? So I'm going to be doing the same thing I did with your face, where I either put something sharp or dull on your on your body, and you're just going to tell me where, you know, what you feel.
Dull.
Okay.
Dull.
Okay.
Sharp.
Okay.
Sharp. Sharp.
Okay.
Dull.
Okay.
Dull. Sharp. Sharp.
Sorry. All right, good. All right, and then I'm going to have you just tell me if you can, you're going to close your eyes again. I'm going to have you bring out your hands for me. I just want you to tell me if you can appropriately identify what way I'm moving your fingers, if it's up or down.
Up. Down. Up. Down.
Okay.
Up. Down.
Good, and I'm going to do the same thing with your toes, so just go ahead and bring your legs up.
Up. Down.
Okay.
Down. Up. Up. Up.
Good. All right. next what I'm gonna have you do is go ahead and close your eyes again. I am going to hand you an object to see if you're able to successfully tell me what that object is based on touch.
Keys.
Good. All right, next we're going to do what's called 2-point discrimination. So I'm gonna have you tell me if I'm either doing 2 points or if it's 1, okay?
2.
Good.
1. 2.
Okay.
2.
Good.
2. 1. 2. 2.
Okay, good. All right. Next, I'm going to have you close your eyes and just hold out your hand. I am going to draw a letter in your hand. I just want you to tell me what letter that is.
D.
Good. And then you're going to keep your eyes closed for the next one. I am going to point to an area of your body. I just want you to tell me if it's the right, left, and what body part it is.
Left hand.
Okay.
Left leg. Right leg. Left cheek. Forehead.
Good.
Right arm.
All right, great. All right, next I'm going to have you go ahead and lay back down for me, Mike, so I can check some of your reflexes out. Go ahead and if you can just lift up your shirt for me. I'm going to check the abdominal reflex, and we are just checking dermatomes T8 to T12 with this. So I'm just going to go ahead and stroke here, and I can see appropriate muscle contraction. Good. All right, so abdominal reflex is normal. Next I'm going to do what's called the plantar reflex. So I am just going to put this up. Oh, sorry, is that ticklish?
Yeah.
And good. And negative Babinski, there's no fanning outward of the toes. Normal finding. And I'm going to do the opposite leg. Okay. Okay. Good. So negative Babinski as well. A positive Babinski is a normal finding in children under 2 of age. All right. So if you want to go ahead, Mike, and sit back up for me, I'm going to check your other reflexes at this point. All right. So I'm going to go ahead and I'm just going to bring up your arm here to check your triceps. Okay. And let me do this side here. Okay, and I'm going to put your hand up here, just relax it. Okay, and let me do the other brachial radial here. Okay, and then let me do the radial. Okay, and the other one. Good. And all your upper reflexes were about a +1 bilaterally. Go ahead and scooch back a little bit in the bed. I just want your knees kind of hanging off so I can check your reflexes on your lower extremities. Good. Okay, and let me check back here. Your Achilles, that was your patella reflex was bilaterally a +1. I'm going to do the Achilles here. Okay. Okay, and +1 for the Achilles. Next, I'm going to check the ankle clonus in your legs here. So I am just going to have you really, really relax. Good. And then really, really relax. Okay. And no ankle clonus noted. All right, the last part of the exam is the musculoskeletal portion, Mike. So what I'm doing is I'm just kind of inspecting. If you could go ahead and stand up for me. I'm just kind of inspecting overall. I don't see any deformities. Go ahead and turn around. All right, everything looks even, symmetrical, no deformities, no, appropriate alignment, size, any tenderness in anywhere of your body right now.
No.
Okay. All right, go ahead and turn back the other way. I'm just going to palpate some different joints over the skin. Any pain, tenderness?
No.
Okay. All right, what about here? Any pain or tenderness?
No.
And your hips. Okay, any pain, tenderness there? Okay, good. So appropriate color, I don't see any redness. Your skin is warm to touch, and no tenderness, nodules felt whenever I was palpating over the different joints. Next, I'm just going to check some of the different muscles here. So the trapezius, the sternocleidomastoid, go ahead and turn this way, the paravertebral. Okay, and then I don't notice any spasms, no twitching noted, no, the muscles do appear to be symmetrical in size. And we're gonna go ahead, and if you wanna have a seat, Mike, we'll start. And I am just gonna start with your hands and wrists here, so I'm just kind of looking over, no pain or tenderness here, right?
No.
Okay. All right, good. So skin looks appropriate. I'm going to have you just take your hands out and bring them up, bring them down, bring them this way, bring them that way. Go ahead and open, close. Take your fingers. Good. And then I'm just going to do some passive range of motion. So make fist for me. And I'm just going to just really relax your fist here. Good. Good. So full range of motion, notice bilaterally. Grade 5 for, let me check your muscle strength actually. I'm gonna go ahead and squeeze. Good. Grade 5 muscle strength noted. And you said no tenderness with any of that.
No.
Okay, good. All right, next we're gonna go ahead and just test your elbows. So I'm going to just look at your elbows whenever you have it flexed in. All right, and the olecrayon process is right here, looks intact. Go ahead and relax your arm. Bring it back out, okay, and everything looks nice. Even motion there, go ahead, I'm looking at it as you have it flexed, good, and go ahead and extend it, good. So good passive range of motion there, and everything looks symmetrical alignment, smooth contour, pink in color. I'm gonna have you do some different exercises now. I'm gonna have you go ahead and just bring your elbows in for me, bring them out, good. And then I'm gonna have you bring your palms up, palms down, good. And then bring your hands back up and push against me and pull back, good. So good full range of motion of the elbows, grade 5 muscle strength noted. Next, I am going to just look at your shoulders here, good. Everything looks symmetrical, any pain or tenderness here, good. Great. All right. So what I'm going to have you do is I am just going to have you do some different movements for me. I'm going to have you go ahead and move your arms above your head. Good. And bring them down to the side and bring them back behind you. Good. And then we're going to have you just move your arms away from the body and back towards it for some adduction. Good. And then I want you to just like come back like you're scratching your back for me and do the same. Good. And then come all the way under, like rotating, good, and then the other side. Great, great. And then any pain or tenderness as you were doing any of those?
No.
Okay. So I'm gonna have you shrug your shoulders again. Good. So good muscle strength, grade 5, full range of motion of your shoulders. And then I actually already did check your for TMJ earlier, but I am just gonna check for like some muscle strength. If you could just open and close your chin, good, and then go to the side with your mouth, good, and then the other side, good. So good full range of motion. I'll just check the TMJ one more time. Go ahead and open and close, good. Any pain or tenderness, okay, no clicks, popping or crepitus noted during that, and good muscle strength and full range of motion. All right. So next I'm going to do some inspection of the cervical neck. Everything looks, your shoulders are aligned in the back here. Everything looks appropriate. I am going to have you just go ahead, Mike, and I'm going to have you turn your head to the side and to the other side. Good. And then can you put your head down and up? Great. All right, so no deformities, everything's aligned with the shoulders, concave for the cervical spine. Earlier when I was checking, the muscles didn't, in the back for the trapezius muscles didn't have any spasms noted. You're able to move your head in all directions. I'm just gonna do some passive range of motion, so just relax your head. I'm just gonna kind of circle it here. Good range of motion, full range of motion, and go ahead and just turn your head to the side, good, and turn and push against me. And muscle strength is a 5+. All right, for the next part, we are gonna check the thoracic lumbar spine. I'm gonna have you go ahead and just like stand up for me, Mike. And if you could turn that way. And I'm just going to check here. Good. Everything looks aligned. If you could just kind of bend forward for me. Mike does have a bad back, and he can't bend too much further than us, can you?
No.
Okay. How much pain are you in as you're...
No, it's all right.
It's okay. All right. So he's a little bit limited with how much he can bend forward. Can you go ahead and just try to hyperextend behind? Okay, good. All right. And then any pain with hyperextension?
No.
Okay. So there was no redness, swelling, or anything noted in the back. The vertebral muscles felt symmetrical, no muscle spasms noted. So next I am just going to have you cross your arms for me, and then I want you to push forward. Good. And push forward the other way. Good. So good strength, limited range of motion forward and even backwards. I'm going to have you go in the bed for me. We're going to do a couple extra little tests just to assess for a couple different things. So if you want to go ahead and lie back. This first test is called the straight leg test. So this test just is trying to see if there could be any potential sciatica or herniation. So go ahead, I'm going to help you up a little bit on pain.
Yes.
Okay. And I'm going to do the same with pain. No. Okay. So with the straight leg test, having pain with that is a positive straight leg test. We just got the MRI results back from Mike's back, and he does have a herniation at L4. So he's following up with his doctor in a week, his neurosurgeon. So I'm going to have you go ahead, Mike, and flip on your belly for me. And we're going to do something called the femoral stretch test. So what I'm going to have you do is I am going to have you just kind of bring up your leg behind you, like all the way, like lift it up. Any pain?
Oh.
Okay, and the other way. Good. All right. Good. And that would just indicate if he had pain, that could mean that there could be some nerve damage. All right, so that was a negative test for that. I'm going to have you go ahead and you can turn back over and lie down. All right, and then I already kind of inspected your hips earlier. The iliac area is symmetrical and aligned. There is normal size, no deformities noted. Do you have any pain in any areas of your hip, Mike?
No.
Okay, good. And no tenderness there either.
No.
Okay. All right, so we're gonna do some different range of motion exercise. So I'm gonna have you bring your knee in if you can. Any pain with that?
No.
Okay, go ahead and bring it down. Bring it into your chest. Good. All right, and then what I'm gonna do is I'm gonna lift your leg out for you and just do some internal rotation. Just bring your leg down. Okay. Any pain with this? Yeah. Okay. And then bring this leg down, and then bring your leg up, and we're gonna do some more internal rotation. Any pain on the side? Good. All right, and then I'm gonna bring your leg up this way. Any pain?
No.
Okay. And bring this way for external rotation.
No.
Pain there? Okay. All right, and then one other thing is I'm just gonna abduct. Are you okay if I bring your leg out?
Yeah.
Okay. And then adduct, bring it in. Any pain or tenderness?
A little bit.
Okay. And go ahead and I'm going to abduct. Any pain?
No.
And adduct. Okay, so on the right side you did have some discomfort, pretty much full range of motion with all of those moves. Just tenderness is noted on the right side. No tenderness noted on the left side. Is that correct, Mike?
Yes.
Okay. All right, so I am going to have you go ahead and bring your knee to your chest for me again, and I'm just going to bring it to your chest, if you want to hold it, and then I'm just going to have you push forward. Good. And then do the same thing with your other leg. I'm just checking your muscle strength and push forward. Good. So grade 5 muscle strength noted. All right, so I am going to do a couple additional tests since we had some pain with that hip. The first test is called the Thomas test. So what I'm going to have you do is I am going to have you extend your one leg and just lift it straight up in the bed for me. Good. And then do the same thing with the other side. Good. And he was able to keep his other leg down as he was doing that. So that's a negative test. Next, I am going to do what's called the Trendelenburg test. I'm going to have you go ahead and stand up for me at this time, Mike, and I promise we are almost done. And I am going to have you turn that way, and what you'll do is I'm just going to kind of look back here, and I want you to stand up on one leg. Okay, and stand up on the other leg. Good. So negative Trendelenburg test, the iliac crest were not dropping when you were standing on the leg. Next, I'm just gonna kind of look at your knees here. If you wanna go ahead and just have a seat for me, that's fine. So I'm gonna look at your knees as they're flexed here, and any pain or tenderness in this area.
No.
Good. All right, and I don't feel any swelling, pink in color, symmetrical in size. I'm just gonna palpate behind here at the popliteal area. Any pain back there?
No.
Okay. All right, now I'm gonna have you, I'm just gonna bring your leg up to check your, I'm sorry, can you just bring it straight a little bit? There we go. All right, so any pain in your knee?
No.
Good. And no swelling, redness noted, any pain or tenderness back here?
No.
Good. And then go ahead and do the same thing. Good. And both knees do look symmetrical. Smooth contour, skin's appropriate, no redness noted, no swelling noticed, no deformities. Next we're gonna go ahead and I am just gonna do some, some range of motion exercises. So what I'm gonna have you do is try to bring your knee behind you. Yep, and then do the same thing, and then go ahead and flex your leg, straighten your leg out, stretch it forward, and stretch it forward. Good. All right, and then I'm gonna just adduct some passive range of motion. Just relax your leg. Just bring your knees in. I'm gonna bring us up, knee in, knee out. Good. In, relax, and then I'm gonna bring your knee in and your knee out for some passive range of motion. Good. And then what I'll have you do is I'm gonna have you go ahead and bring your leg straight out, and I'm gonna just check the strength and bring your leg back out. Good. And then bring it in. Good. And bring it in. Bring it in. Good. So muscle strength is a grade 5, full range of motion noted in your legs and your knees. Okay. So I am just going to inspect your feet now, and I am going to have you go ahead and stand up and turn around so I can just look at the back of your feet. Okay, so weight bearing is midline. Good. And go ahead and have a seat back down, Mike. And everything looks good. Non-weight bearing as well. The Achilles tendons back here. Any pain, tenderness anywhere I'm touching?
No.
Okay, good. All right, so feet are well aligned, symmetrical, no deformities. I'm going to go ahead and just palpate the phalanges here. Good. And I don't feel any nodules as I'm palpating, any pain or tenderness.
No.
Good. And you have 5 toes on each foot. Also, earlier I didn't palpate your fingers. Let me just go ahead and palpate. All right, good. Any pain with this?
No.
Good. And 5 fingers on your right hand. And 5 fingers on your left hand. No nodules or deformities noted on any of your fingers either. Okay, so next I am going to have you just go ahead and bring your, point your feet up to the ceiling. Good, and point them down. Good. And I am going to just kind of like do some inversion, so relax your leg here. Some passive, so I'm going to bring it in and bring it out. Good. And bring it in and bring it out. Good. And then lift up your feet to the ceilings again. I'm just going to put some, good, and push it down. Good. So grade 5 muscle strength. Go ahead and just roll your feet like kind of like that in a circle. Here, I'll help you. Good. Good. So full range of motion and bilateral legs, grade 5 for muscle strength. And I did have you walk earlier. You had a nice steady gait that was symmetrical. Your body was in line. Your standing posture was erect, symmetrical. Head was over the gluteal cleft, the shoulders, the iliac crest, the gluteal folds, and the were nice and aligned horizontally where the occiput, shoulders, and the buttocks and heels were aligned vertically. Okay, Mike, any questions or concerns with that assessment?
No.
All right, well, I appreciate your time. And if anything comes up, please feel free to reach out to the office.
Thank you.
Thank you.